Trigger points are tender points within muscle or fascia that are responsive to stress-induced change. We've got two main types of trigger points. There are active trigger points, which can spontaneously cause referred pain into surrounding areas, or the active trigger points can cause referred pain when they're pressed. And then we have latent trigger points. And latent trigger points will not cause referred pain. They'll just be tender when you press them, just in that area, but not surrounding areas. Trigger points can affect athletic performance in several ways. Primarily, athletes that have trigger points in their muscles will feel a loss of timing. They'll feel out of sync with what they're doing. It can also affect muscle flexibility and performance in other ways. Now, finding trigger points should not be difficult for most massage therapists. The easiest way to find them is, rather than poking and prodding for them that way, is to actually be massaging the muscles. And as you're massaging the muscle, you'll feel a tight spot in the muscle where a trigger point is. You can also get a clue if a client flinches, kicks, screams, or any subtle signs can tell you that you found a trigger point. Now, for treating trigger points, we need to hold the point with steady pressure. This creates a localized ischemia, or lack of circulation. The way this works is that there can be a cycle between pain and muscle spasm, where pain can cause spasm and spasm can cause more pain. And by holding the point steady, what it does is it causes a localized ischemia, or lack of circulation, which will cause the spasm to let up. Common mistake I see many therapists do in treating trigger points is to press it, but then to start goading it and to start moving. And this actually increases the circulation to the area, but it won't necessarily release the trigger point. What we want to do is stop the circulation to the area. There are a number of people that talk about working trigger points and just holding and pressing for 7 to 10 seconds. And that may work if you press hard enough, if you say you're using an elbow or something and going in very deep. But it also can be fairly painful. What I like to do with trigger points is combine it with another type of work called counter strain. And counter strain is a technique that was developed by an osteopathic doctor, Dr. Lawrence Jones. And this technique involves shortening a muscle so that it can release. So say, for instance, if we had a trigger point in the rhomboids, what we could do is find the point and press it, and then pull the shoulder toward that point so that we shorten the muscle. The idea is to give the muscle what it wants. If it's wanting to contract, we put it in a state of passive contraction where it's shortened, and that can allow it to release. The nice thing with this technique is that it's painless, because when you get the muscle in a passive contracted state, it no longer hurts. So you can hold the trigger point, and again, this takes 30 to 90 seconds. Oftentimes you'll feel it let up under your thumb. And then you can bring it back to the original position, and the client can report that it's no longer painful. Now, for trigger points on the client's back, we find that the trigger points typically will be either right next to the spine on either side, or about an inch out from that. In acupressure, it's what's called the bladder meridian. And let's take a trigger point, say, in the rhomboids, and this can refer to the surrounding area. There's a couple different ways of treating this. We can treat it just like a trigger point with pressure, or we can apply counter strain. And for this, what we can do is take the client's shoulder and pull it back toward the point while still pressing the point. And notice I have my forearm so it's over my thumb. That way I'm getting the right angle. We also know it's right if the client can report that there's no pain in this position. So what originally would have been painful is no longer painful once we get the right position. And that's because the muscle, which was contracting, is being allowed to be contracted, and so it's no longer painful. The position is not right if we're pulling down this way. We want to pull right toward the point that we're pressing. One of the hard parts about this is holding the point static for 30 to 90 seconds. This can be hard on body mechanics, so you need to make sure that your back's straight and that you're doing this work with your body weight. Oftentimes you can feel the trigger point just kind of melt under your thumb, and then you can gently bring the client back into neutral position, still holding the point, and oftentimes the client will report that the pain has let up. Now, I find it a little bit difficult working on the opposite side of the table that way. That's how I was originally taught. So what I often do now in the upper back is to work on the same side of the table. I'll find a trigger point. Again, we can massage and feel for one here. Is that tender there? Okay. Find the trigger point, and then I bring the shoulder up like this, and I will hold it with my knee so that I'm pressing the shoulder toward the point, keeping that same vector. And I find this a lot easier to hold than in the previous position. And again, we can hold it from 30 to 90 seconds. And as we feel the point let up, then we can bring the client back to neutral position. Does that feel better now? Good. Now, for treating trigger points in the lower back, I originally was taught to find points on the opposite side of the body. You can feel around and find a tender spot. Is that tender there? Yes. Okay. Then you bring the leg out to the side like that, and that's so the ASIS is raised up. And then holding the point, you can lift the ASIS, that's the front of the crest of the ilium, pulling it back toward the point, and hold it for 30 to 90 seconds till you feel the point release. And ideally, this should be a position where there's no pain. Does this feel okay in this position? Yes. Okay. Then we hold it, feel it let up under the thumb, and then we'll bring the leg back. And how's that feel now? Good, good. Now, I find that a little hard for body mechanics, so what I like to do now is we'll find a trigger point on the same side of the back. Is that tender there? Okay. And then what we'll do is bring the leg out to the side, and I will lean in with my thigh, pressing Benny's knee toward her low back. How's this feel now? Good. Good. So I know I have the best position. If it didn't feel good, if it was still a little painful, I may have to adjust how far the knee is out or the angle that I'm pressing on the knee. This positions it so that there's no pain and can allow it to release easier. And again, we hold this for 30 to 90 seconds. I can feel it let up under my thumb. It's letting up now. So we bring it back, and I continue to hold the point even as I bring Benny back into a neutral position. That way I can ask, how's that feel now? Good, good. So that's how we'll work trigger points in the low back area. Now in the hip area, we can have trigger points in the gluteus maximus or the gluteus medius. So we can have points either along the sacrum or very often along the iliac crest. Is this tender here? Yeah. Okay. Then what we do is take the client's leg, bring it out to the side. Now, how is it in this position? A little better. A little better? Okay, I'll move it a little further. How is it now? That's better. Good, good. So we find the best position, then I can add a little compression, leaning in with my thigh into Benny's knee, pressing toward the point that I'm holding. And we hold this anywhere from 30 to 90 seconds to allow it to release. And again, you may feel it let up underneath your thumb as you're holding it. So then, as we feel it release, I can bring Benny back into neutral position, still holding the point. We can also find trigger points in the hip area around the piriformis. And the piriformis muscle is often involved with sciatic pain, where you usually find the trigger point is right in the middle, right about here. Is that tender, Benny? Yes. Okay. Then what we do is very similar to before. We bring the leg out to the side, let it rotate like this. How's that now? That's better. Good. And like this? That's even better. Good, good. Okay, then what I'll do is lean in with my thigh, pressing Benny's knee toward the point that I'm holding. And like before, we hold it for 30 to 90 seconds to allow it to release. And in this position, there's no pain, so it can allow it to release easier. I always hold the point even when I bring the client back into neutral position, because sometimes they won't believe that you're on the same point, because it won't be painful. And it can be hard to find the point sometimes if you take your thumb off of it, since the pain is released. So I felt it let up now. We'll bring this back. Now on the hamstrings, we often find trigger points either near the origin, which will be near the ischial tuberosity, or near the insertions. Let's feel around here, and I feel one set tender there. Okay, so we have one here on the biceps femoris on the lateral side. Now to shorten this, what we do, since the hamstrings do knee flexion, is we flex the knee, and I find it usually works if I get the foot above the point. How is it in this position? Okay, how is it like this? Good. And it's often like finding the right gear with the gear shift. You can be moving it around, trying to find the best position. Let's get back there. Is this the spot? Good, okay. So you find the best position, and then you just hold it for 30 to 90 seconds, maintaining the pressure on the point with your thumb. And then as you feel the point release, we can bring the foot back to the table. In the calf area, we can have trigger points in the gastrocnemius or soleus muscles. Now again, to find these, I find general massage techniques seem to work best. Going over the muscles, feeling for tight spots. And I feel a spot in here. How's that feel, Benny? A little tender. Okay. So what we'll do, if it's gastrocnemius, since that crosses the knee joint, we'll need to flex the knee. If it's soleus, we don't need to flex the knee since it doesn't cross the knee joint. But for either of them, we need to plantar flex the ankle. Press the heel down like this. How is it in this position? A little better? Okay, how about like this? Okay. So what we're going to do then is to hold it again for 30 to 90 seconds. It's in a position where there's no pain, so it can allow it to release. And then as we feel it let up, gently bring it back to the table. And how's that feel now? Good. Now for working trigger points on the neck, I like to do it from a sitting position because it's better for body mechanics if you're holding a point for a while. And there's several different areas we can find points on the neck. In the upper neck, we often can find a point for the splenius capitis. In the middle of the neck, there's points for multifidus. And in the lower part of the neck, you can find a point for the levator scapulae. And all of these have their own referred pain patterns. Positioning can be different for different points. I find in the upper part of the neck that it may involve an Egyptian-type movement of bringing the head laterally, what we call lateral displacement. Often you'll find a position where there's no pain. In the middle of the neck, it often is rotating the head toward the same side that you're pressing the point, and also flexing it toward that same side. How is it in that position, Benny? Once you find the best position, then you take your hand and press the top of the head, whatever part of the head is on top, down toward the feet. This adds a little extra compression and can relieve the pain even more, shorten the muscle even more. And we hold this position 30 to 90 seconds to allow it to release. And then continuing to hold the point, bring the head back to the midline. How's this feel now?
It's good.
Good. And then in the lower part of the neck, point for the levator scapulae, I find sometimes we need to turn the head away from the trigger point and then flex it toward. And then, how's that feel in this position?
It's better.
Good. And like this?
That's good.
Good. Then I press whatever part of the head is on top, adding a little compression, pressing down toward the feet. And I hold the trigger points usually with my middle finger. I find that's easiest on the neck. Hold this 30 to 90 seconds. And then as we feel it let up, Bring you back to the midline like this. Now on the upper part of the shoulder, we can have trigger points either in the trapezius or the supraspinatus muscles. And when you find a trigger point, if it's in the trapezius, you can rotate the head toward the side and flex it toward the same side. Does that help with that?
Not really.
Not really, okay. If nothing that you do with the neck or head makes a difference with the pain, then very likely it's coming from the supraspinatus muscle, which is just deep to the trapezius. This is where knowing the anatomy is helpful. What we'll do is, still pressing the point, we'll abduct the client's arm, which is what the supraspinatus does. How's it now?
That's better.
When we get the right position, then you can pull the elbow in toward the point just to add some more compression. And I'm holding the point now with my middle finger. And we'll hold the point for 30 to 90 seconds in this shortened position. And then as we feel it let up, we can bring the arm back down. Now there can be several different trigger points in the pectoralis major area, and they're not difficult to find. What we can do is massage in through here. A little tight spot right about there. Is that tender?
Mm-hmm.
Okay. That's just below the clavicle. So what we do to shorten this is to bring Benny's arm up like this so the elbow is over the point. How's that feel now?
Good.
Good. Okay, then I just hold this and I can press the elbow down a little bit toward the point to add some compression. And we hold this 30 to 90 seconds. And I find for points, especially in the thoracic and abdominal areas, that you can have the client breathe into the point. So just breathe into that. Try and push my thumb out with your breath. And I find this allows the points to release even faster. For trigger points on the deltoid, we can find trigger points on the front or on the middle fibers of the deltoid. On the front fibers of the deltoid, we'd bring the arm up like this and hold the elbow above the point like this. How's that feel? Good. And we hold that 30 to 90 seconds and then release it. If it's on the middle fibers of the deltoid, we can just bring the arm up like this, do abduction, and hold it until it releases and come back. Now on the biceps, the trigger points are often found on the distal end of the muscle. So as we search for trigger points, find the tight spot right in here. How's that?
A little tender.
Okay. So the biceps do elbow flexion, but they also do supination. So we want to supinate the forearm. How's that now? Okay. And then we're just going to hold that again for 30 to 90 seconds to allow it to release. And then as we feel it let go, bring it back this way. How's that?
Good.
Good. Now on the front of the forearm, we have our wrist and finger flexor muscles, and these flex the wrist and fingers. They're often tighter in people that do manual labor, do a lot of gripping, like carpenters or plumbers. Whereas on the back of the forearm, we have the wrist and finger extensors. And these will be tighter in people doing a lot of computer or keyboard work. They can also be tight with people with tennis elbow. Doing the backhand in tennis often involves the extensors. We're going to work first on the flexors. And to do this, we turn the palm up and we search for trigger points on the flexors. And usually they'll be more at the proximal end near the medial epicondyle. Is that tender there?
Mm-hmm.
So we find the point, and then we flex the wrist, and we can also flex the elbow some too. How's it in this position?
Good.
Good. Then we'll just hold this for 30 to 90 seconds to allow it to release. And then the extensors on the back of the forearm, we can turn the arm over like this. Again, these will be on the proximal end, this time near the lateral epicondyle. That tender there?
Mm-hmm.
And almost everybody will have trigger points here in the extensors. And what we do is extend the wrist. How's that in this position?
That helps.
Okay. And again, we hold this for 30 to 90 seconds to allow it to release. For trigger points in the thoracic area, what I like to do is work on the opposite side of the table. We can find trigger points along the side in here. Is that tender there?
Mm-hmm.
So what we do is hold the point and then take the side and pull it in toward the point like this. How's that feel now?
Good.
Good. And then I want you just to breathe into this point. And again, body mechanics are important because it can be difficult holding a point 30 to 90 seconds like this. So I'm using my body weight, just leaning back to get the pressure this way. And you can have the client breathe into the point. And then you feel it release, so we come back out. And how's that feel now?
Good.
Good. For trigger points in the abdominal area, I often find it easier to work on the side of the body away from me. We can palpate for the points using the flat part of our fingers. Feeling through here. Does this feel tender here?
Mm-hmm.
Okay. So then what I like to do when we find a tender spot is to bring the client's knees up. This will relax the superficial muscles. And that's because the points aren't necessarily in the superficial muscles. You can have trigger points in the intestines as well. And then I will take the side of the body and pull it toward the point like this. How's that feel now?
Fine.
Good. So we have a position where it's pain-free, and we can just hold that for 30 to 90 seconds. Also, Benny, what I'd like you to do is breathe into this point, and breathe in so that you're trying to push out my fingers with your breath. That can allow it to release faster by her breathing into the point. Good, good. I can feel it letting up now. So what we do now is it lets up. Let's come back into a neutral position. Bring the knees back down. Now press in here. How's that feel now?